This conference will now be recorded.
Good afternoon, everyone. Thanks for joining us for a media briefing for September 16th, 2020. This is Melissa Moran. I'm a public information officer with the Whatcom County Health Department, and I'll be moderating today's media briefing. Just a few reminders before we get started here. Currently, the chat feature is disabled. We'll open that up after we hear from each of our speakers and invite members of the media to ask questions at that time. You can go ahead and type your name and affiliation into the chat feature, and we'll call on folks in order to ask questions when we get to that point. As I said, this media briefing is being recorded and will be made available later this afternoon on the Whatcom County Government YouTube channel. It'll also be available on the Whatcom County Health Department's COVID page. You can find that at www.whatcomcounty.us/COVID and head on over to the media page where you can find recordings of this and all of our past media briefings as well. We have several speakers today, both from the health department and from our partners at Western Washington University. Today, we're going to be hearing from Erica Lautenbach, Director of the Whatcom County Health Department, Cindy Hollinsworth, Communicable Disease Manager at the Whatcom County Health Department, Hunter Stoom, who's the Communications Director for the Associated Students at Western, Dr. Ciclina Ledbetter, who's the Executive Director for Counseling, Health, and Wellness at Western, and Dr. Steve Bennett, an Assistant Professor of Public Health at Western. And with that, I'm going to go ahead and turn it over to Erica to get us started.
Thank you, Melissa. Thanks for joining. Good afternoon, everyone. I will be brief in my comments because we have a full agenda and lots of really helpful and interesting information. So I just want to give a brief overview of where we are with regard to case counts, contact investigations, and public health system performance. So we are seeing slight increases in cases, as you may have noticed, since the last week of August. We are noticing that the highest percentage of individuals that have been recently diagnosed continue to be young adults between 18 and 39. And consistent with that, our highest testing rates are among that population. The high test positivity in young people, 0 to 17, is it's about 3%, and that test positivity rate suggests that there are also additional cases that we are not catching in that age range. We have resumed testing today after a hiatus due to air quality issues and safety and health of our staff, volunteers, and of individuals testing, but that has resumed today. And we've been working to alert folks who were signed up to be tested on the days that we had to cancel and help to prioritize those who had a known exposure or symptoms to make sure that they were able to get testing quickly. So we continue to do testing. Our testing with Whatcom Unified represents about a quarter of the overall tests conducted in Whatcom County. And we do intend, once we have additional access to the Test Directly system, we will be able to produce official counts on our website, and we'll be able to share that with the public and the media. So that is forthcoming. In terms of what we're seeing in our case and contact investigations, about 44% of confirmed cases have a reported epidemiological link, which means that we were able to identify them as a contact of a case or have some exposure to an existing case. About 21%, so 1 in 5 individuals reported participating in a group activity or event, and the number of people at the reported events has increased from 10 to 20 are more commonly reported in the past 2 weeks. And the average number of contacts per case is 3. And I would be happy to I'm rattling off quite a bit of data, so I'd be happy to share that again, either in writing or if you didn't get that all down. As of September 10th, with regard to case and contact investigations, the Whatcom County Health Department has 32 individuals available to conduct case and contact investigations. And we are able to keep up with case and contact investigations due to the combination of existing staffing, temporary staff, and volunteers. And we are meeting our benchmark of contacting over 90% of cases and having conducted interviews within 24 hours of learning of new cases. So we continue to be able to keep up with that level of work and are able to quickly identify cases and their associated contacts, so we can continue to try to contain the spread of this virus. So with that, I will turn it over. I believe Dr. Ledbetter has not joined us yet, so I will turn it over to my colleague, Cindy Hollinsworth, our Communicable Disease and Epidemiology Manager. Oh, there's Dr. Ledbetter. Thank you for joining us, and I will turn it over to you. Thank you for joining us.
Great, thank you. I had a little technical difficulties, but I made it in. So at Western, we have been working really hard since early March. And one of the things that we did very early, I think there were less than 10 cases in Washington State when we ramped up an incident command structure. And I'm sharing that because it's important to note that that has been the structure that has helped us form and forge these incredible partnerships that we have both internally, as we have been able to work with our colleagues across campus to really be very nimble and flexible and pivoting off campus and now returning to campus. If you follow in the news cycle, like most of you are, you know that around the country that they're making it very tough for us to even conceive of what it means to come back on campus. But what it also means is that as a semester, as a quarter-based system versus a semester-based system, we've had an opportunity to learn from those early adopters or those schools who have entered early. And we've learned that there have been some similarities in that we're both many of them are public institutions, but they are big institutions and they have football teams and frat houses, fraternities and sororities, and they often start the year with large gatherings and large parties. And so over the past 6 to 7 years, we know that we have had a reduction in our noise pollution and our noise complaints from our neighborhood associations. And so not having a football team and not having fraternities and sororities are really going to help us in terms of getting a handle on the large gatherings, which is often what our community members, as we've been talking to them, are concerned about. Normally, we'd be welcoming about 15,000 students to Bellingham, and move-in time at Western is an exciting time. We're trying to keep the excitement, except we're not going to be moving in welcoming 15,000 students to Bellingham, as we have gone mostly virtual. And so we typically house on campus about 4,400 students. This year, we're welcoming about 1,000 students. And so they're going to be very sparsely placed in university residences on campus. And so we're also, given the risk that we have, we are also going to be doing most of those courses remotely. So even students that are on campus, many of them are there because they want to have the college experience, but they are going to be remote on campus. Starting this week, it was going to be tomorrow, but we've had some challenges clearly with the weather. And so we've had to, I think what COVID has allowed us to do is practice our pivot muscles. And so we've had to do that again with the weather, with the smoke. And so we're only going to be inviting those families that have nowhere else to go when they've kind of maybe taken flights or they've driven, several hours. We're going to be inviting them, but mostly we're inviting people to push back move-in date. And we've staggered our move-in to about 20 people an hour. and over the course of 5 days instead of what's usually 4,400 students over one weekend. This will be over 5 days. In terms of the messaging, we're also, we're an institution of higher education and believe very, very strongly in teaching our students to have agency. And so we're messaging very aggressively on the Be Well at Western campaign and the 3 W's, right? Wash your hands, wear your mask, and watch your distance. And we've been pushing those messages pretty aggressively for a while now. We also have and Hunter Stoom will be able to share with you the student version of our messaging, but we are hitting on all fronts because as you'll learn a little bit later also from Dr. Bennett, there are things that students want to hear from administrators and things that they would rather hear from students. And so we are, deploying sort of a multifaceted communications and messaging strategy that seems to be working well. Our students are on board and they're doing an amazing job. The other thing that we've done and we're really excited about is we have cemented partnerships that we already had with the Whatcom County Health Department, with Northwest Indian College, with BTC and WCC. We've been talking to them weekly about their plans, and we've been sharing materials, messaging materials and data and insights on how to conduct our surveillance program so that we can employ and engage the best knowledge and talk about how we are in this together. Because when community members are thinking about how to, whether or not to call on a disturbance in the neighborhood, oftentimes they think it's Western, but with all of us together, what we realize is that this is a community effort. And so we are all in this together, all of the institutions, and led by the Whatcom County Health Department. And so we're very grateful for that. I think I am going to pause there and pivot to Cindy Hollinsworth from the Whatcom County Health Department.
Thank you, Cislina. Good afternoon, everyone. Cindy Hollinsworth. I'm the Communicable Disease and Epidemiology Manager here at the Whatcom County Health Department. And I just want to reinforce what Dr. Ledbetter said about this being a community response. We're working closely with all of our partners who support persons in our community in this target age range. And we're working also with Bellingham Technical College and Whatcom Community College, as well as other partnerships. So we're in terms of Western, we have really cemented our relationship there. We're working closely with the Student Health Center around their plans to screen incoming students for COVID and screen on an ongoing basis for symptoms. And then they just really have some solid plans for isolation and quarantine support. And then we've had discussions about how we are going to coordinate that support between our agencies. We had an opportunity this summer to host 4 of the community health interns from that program, now the public health program. And they came onto our team, and the 4 of them worked full-time all summer as case and contact investigators, and really truly became like this champions for technology, for lots of changing technology over the summer, for helping us implement all these interviews on a wide scale basis. And so we're continuing to work. Their internship has ended. A couple of them actually applied for paid positions here and were hired. So that was a great next steps for them. We are also working with Western closely about some opportunities for possibly hiring work study students or other types of shared staffing resources to support response. So I think with that, I will turn it over to Steve Bennett.
See, okay, there we go. Sorry about that, I couldn't get my camera to turn on. Thank you, I'm Steve Bennett, a professor of public health at Western Washington University. I wanted to talk about some data that we found from a survey that was sent out countywide, as well as some focus groups that I coordinated with Western Washington University, Whatcom Community College, and Bellingham Tech. And The survey that was sent out was to determine many of the drivers of behavior, what kind of behavior people were participating in, why did they choose those things, as well as just general impacts of the pandemic on people, and specifically to look at the impacts and challenges that young adults were facing. 4,700 surveys were completed, with about 900 of those being in the young adult, so 18 to 26-year-olds. And some really important data came out of that. One of the first things that we learned is that self-reported adherence to prevention behaviors is very high in public spaces, but significantly lower in what we would deem to be private spaces. Across all age categories, almost all respondents, about 90%, say that they observe COVID-19 prevention behaviors in public places, such as wearing masks, avoiding large public gatherings, and staying 6 feet away from others. In contrast, these numbers drop dramatically when people are in private spaces. And by private spaces, we define that as being around friends and family that you don't live with. So this is still outside of your own home, but where you're hanging around or hanging out with people that you know or family members. Here we see that about 80% of people say that they're attempting to avoid private gatherings, often or always. However, significantly fewer people say that they wear masks or maintain physical distance in private. About 67% of people over the age of 27 say that they stay 6 feet apart from others at private social gatherings. That number drops to 41% of people aged 18 to 26. Additionally, 58% of people over the age of 27 say they wear masks in private settings, but 45% of those who are 18 to 26-year-olds wear masks when around their friends or family. The low rates of adherence to prevention behaviors in private settings is all the more concerning because in those situations, people are likely to spend larger amounts of time with close family and friends, and transmission when people are inside in households or through households and social contacts continues to be significant. So there we can see a behavior that is worth focusing on and trying to support students and young adults. When we talk about why young adults are having challenges with incorporating this behavior in what would be deemed their private life, we learned that navigating peer and family pressure is a key barrier to achieving this type of behavior and to incorporating social distancing and other preventative measures in your private life. Across all age groups, survey respondents reported high confidence that COVID-19 prevention behaviors are effective at stopping the spread of COVID-19. So this indicates that this is not a lack of knowledge or misunderstanding that is driving people to not engage in social distancing or wearing masks. Survey and focus group data indicate that the primary barrier to wearing masks and maintaining physical distance in private settings is the difficult in having what a lot of students were referring to as difficult conversations or awkward conversations with friends and family about engaging those practices, and the inability to control the behaviors of those around them. Also not wanting to feel different if they are around friends. They don't want to be the only friend that shows up wearing a mask, and they're worried sometimes about what that might communicate to their friends. Focus group participants reported that conversations about mask use and physical distancing are awkward. They fear conflict or the perception that it might bring up conflict between them and their friends. And they experience peer and familial pressure when talking about or practicing behaviors that feel unnatural in private spaces. The other thing that we learned that's really important when we think about supporting students and the population in general is that doing real life COVID means acknowledging and responding to the mental health challenges and barriers that people are facing. Social isolation and the stress of the COVID-19 pandemic are exacerbating the already existing mental health concerns that exist for youth and young adults. According to the survey, nearly twice as many young adults aged 18 to 26 report feeling depressed or anxious compared to those that are 27 or older. 41% of survey respondents aged 18 to 26 reported often or always feeling depressed. And 71% of the young adults reporting to our survey reported feeling often or always anxious. This is particularly concerning given that the youth mental health was a priority health issue in the 2018 Whatcom County Community Health Assessment. And so when we take these lessons, we really need to make sure that we are incorporating these lessons into how we're communicating with youth and how we're supporting youth communicating and young adults communicating to each other, and also making sure that we are addressing the barriers that people have to achieving the behaviors that we're asking of them. One of the ways that we're doing this is to try to partner with youth to have youth-driven and youth-led message and young adult-led messaging. And so I will now introduce Hunter Stoom, who is the Western Washington University Associated Students Communications Director, to talk about that.
Thank you so much, Dr. Bennett. Apologies to everyone. I'm having some camera difficulties, so let me know if you have any troubles hearing me. As Dr. Bennett mentioned, my name is Hunter Stoom. I'm the Communications Director for the Associated Students of Western Washington University, which is Western's official student organization. As mentioned, a priority of the Associated Students through the coronavirus pandemic has been very much creating responsible and well-informed messaging for Western students to engage in responsible social practices. So what we see across the country is sort of a villainization of young people in some respects for making or demonstrating poor choices or demonstrating poor and irresponsible social behaviors. The Associated Students at Western, our priority has been very much about how do we create positive messaging that reinforces safe social practices and creates content that's highly shareable amongst students in the 18 to 26-year-old age range on social media to encourage safe socialization behavior. Also, as Dr. Bennett had mentioned, students have felt like those conversations around mask wearing, physical distancing, taking the safety precautions that are necessary to slow the spread of coronavirus in our communities are awkward. At the Associated Students, we've created a marketing campaign that we'll be launching very shortly called COVID-19 in Real Life. The purpose of this campaign is to reach college students in the 18 to 26-year-old age range and encourage and normalize the safe social practices that are going to be necessary to slow the spread. As of right now, we have about 13 messages that strategically target the needs that students have brought up, either through Dr. Bennett's research or through some informal survey market research that we've run among Western students on campus. Some of those priorities have been around providing tips on safe socialization behaviors, ways to interact and stay connected with your friends and loved ones through the pandemic. Also, another important priority has been providing tips on how students can have the difficult conversations with their roommates and housemates to set boundaries and norms in their households to slow the spread of coronavirus. Another important priority has been around maintaining mental health during quarantine, ways that students can practice and remember to continue practicing self-care through this period of physical distancing when students are disproportionately reporting higher rates of mental health concerns, anxiety, and depression. As of right now, we've created this campaign and are working to try and partner with our friends at Bellingham Technical College and Whatcom Community College, as well as with our friends at the Health Department and at Western, to really increase and boost the reach of this messaging as far as we can across the county. Our goal, while we design this messaging very much around Western students, is to really reach anyone who can ingest this information in a different voice and in a different way, while also being well informed and complimentary of our healthcare professionals' advice. I would say, the themes of this messaging are very much around creating positive, fun, student-directed messaging that students see student voice reflected in, and again, that is highly shareable to try and increase its reach. Some other ones that we are trying to think about, some themes in the messaging are also trying not to be prohibitive in nature, but really create content that is by students and for students, and that is positive in such a way that students can join on and start practicing the safe socialization behaviors that are going to be necessary to slow the spread of COVID in our communities. With that, I would turn it back over to Melissa, the Public Information Officer for the Health Department.
Thanks so much to all of our speakers for sharing with us today. We've opened up the chat feature. So again, we invite members of the media to go ahead and type in your name and affiliation there, and we'll get started with some Q&A. In the meantime, I just want to let folks know, I know we ran through a lot of data and numbers today, and if you would like follow up with any of those specifics, you can reach out to us at wuc_jic@co.whatcom.wa.us, and we'll be able to share any of those details or any follow-up questions with any of those specifics. So we'll just take a pause here and wait to see if we have any questions roll in. I know we've got a smaller crowd today, so feel free to also just unmute yourself if you have a question as well. But it looks like our first question is from Key Relia with the Herald. Key, you can go ahead and unmute yourself to ask your question. Oh, I'm sorry. I just see in the chat that you say your mic is not working. Key's question is, how will you get the message to students? I think probably Hunter and Steve could speak to that question.
Yeah, I'm happy to speak to the distribution piece. As originally designing the campaign, the purpose was to create the content exclusively for social media, that it would be able to be shared by students on their social media accounts, acknowledging that many students are all over the country or all over the world. Right now, depending on their class situation being online. Recently, though, we've explored getting the messaging in print form to be distributed through campus residence halls, as Dr. Ledbetter had mentioned earlier, where there will be few but still some students in the campus residence halls getting print materials up, as well as through campus, and then exploring potentially also distributing some of that messaging throughout the community. And again, those are still collaborative efforts that we're exploring with our friends at the health department, as well as at Bellingham Technical College and Whatcom Community College, based on the individual messaging needs that we feel for our student populations.
I just wanted to add as well, I think it was alluded to by both Dr. Ledbetter and Hunter when they were talking, but one of the things that we found and that we've actually seen even when trying to get information from students, I just realized I have a camera too, was that students already feel overwhelmed with the messaging that they're getting around coronavirus, as many people in the general population do. We're getting a lot of information, constant information. There's a bit of COVID fatigue that has set in with students, but they are very open to hearing from other students. And I think that that's why the partnership with Hunter and the associated students at Western Washington University is so important, because kind of having this grassroots communication and campaign is going to be really helpful, because students want to listen to students. And so using students is really going to be key in this process.
Thanks. Our next question is from Joe Tehan with KGMI. Joe, you can go ahead and ask your question.
Okay, I was just wondering if there's a quarantine plan ready, just in case there is a spreader event involving Western students.
Hi, Joe. Yes, we already have a quarantine plan, isolation and quarantine plan in place for students. We typically have about 4,400 students on campus. We're having about 1,000 that live on campus now. And so that leaves a significant amount of space for us to offer quarantine and isolation. We've designated a space in a significant number of beds for isolation and quarantine for on-campus students. For off-campus students, we are taking the lead of the health department, although we will be partnering in terms of contacting them and doing the surveillance of them, because if they are taking if they're taking classes on campus, they're going to be a part of our testing and surveillance program. But the isolation and quarantine plan has been well developed and is already in place.
Just to add to that, Joe, our isolation and quarantine facility as a community is also available to students that live off campus, as it is to any residents of Whatcom County. So we appreciate Western kind of going the extra mile and making sure that students living on campus have safe places to isolate and quarantine, but we also have our facility available too.
We will do one last call for questions, and if there are no more, I think we can go ahead and wrap things up for today. So if you have any final questions, please feel free to unmute yourself in order to ask.
Joe Tian has one quick one.
Yeah, go ahead, Joe.
Okay, I'm wondering, so will students be tested as they arrive? And I understand that from an earlier bulletin from the university that there's going to be a testing protocol of roughly every 2 weeks. Is that still accurate?
Yes, students will be tested when they arrive on campus. And as part of our surveillance program, we're going to be testing students every 2 weeks. And so it ends up being about 300 students a day to reach every student every 2 weeks. And so that's it's kind of a unique. I think we're really fortunate to have Northwest Labs as a partner in this, and as well as the health department, because we're going to be doing pooled testing. And so what that does is it allows us to test more students more often, and to be able to surveil a greater number of students. And so they will be tested when they arrive, and then every 2 weeks thereafter.
Thanks, Dr. Ledbetter. And there is another question about the availability of the information from the survey and focus groups that Dr. Bennett was a part of. We will go ahead and make that final report available online. And I do see, Key, that you're interested in receiving that. We'll go ahead and make sure that folks are aware of how to access that once it's available. And I do think that that will wrap things up for today. So again, thanks to all of our speakers and thanks to everyone for attending.